Hello friends, myself Dr. Pradeep Tiwari, and as you all know, the NEET PG results have been declared yesterday, and I take this opportunity to congratulate all the rank bearers, all people who have got a decent rank. Within a span of 24 hours, the results were out yesterday night, yesterday evening, and by today evening, a lot of people have called me that they have secured a decent rank and they are not able to proceed to how counseling procedure has to be done. I mean, what branch should they take at their rank, which is the best branch they can actually take. So I have made this video, and I will go into some very important details that you need to know about this PG counseling. And since most of in last 2 years there hasn't been a lot of ward activities. Most of the hospitals were doing COVID work, so people especially in the exposure that you have during internship as to which branch you should take. Personally, people get that scope or get that interest during their internship. When they go into different departments, they go into different wards, they actually spend time in particular field, so they actually get to know that which field they are made for, which kind of a specialty. Since that has not taken place in last 2 years due to the COVID situation, a lot of people have been at home. Internships haven't been the way internships used to be, so they actually don't have the experience of working in that particular field, and they are very confused as to which branch or which college they should take at their rank. So the main purpose of making this video was to give an orientation or an approach to how you should proceed with this counseling, including which branch should you take. So first of all, let me tell you that this year counseling process will be a bit uh, tough for all India rankers, because this year you have something like an 80% reservation in the counseling process. There's 10% EWS quota, and then there's this 25 or say suppose 23% OBC quota, beside the 50% quota which already exists in all India ranking. So that will make the total uh, quota reservations to somewhere around 70 to 80%. So you all people in open category will be severely affected, because you are actually fighting for those 20 to 30% seats only. So if you see the all India counseling, you people used to fancy a lot of their chances in all India counseling. This year it won't be that way. All India counseling will be more tough. So if you have a state rank, there's better chance, depending on which state you are, there's better chance of securing a decent seat of your choice, the branch of your choice at a particular rank, through the state counseling rather than from the all India counseling, because all India counseling is going to be tough, as I mentioned. Certain states have reservation even beyond 70% to something like 80%. So in those states, again, state counseling is going to be tough. But overall, the all India counseling, which a lot of people used to be very enthusiastic about, they used to fancy their chances of getting a seat in better states without any bond through the all India quota. So this time that won't be so easy. Second important thing I want people to know, that a lot of people have called me and said me which branch should they take. Now there's a very interesting story, two personal stories that I want you to know. There's one story in particular which my sir used to tell me during his university time. He was in the Bombay University during that time, and he was the topper of the university, and he actually took surgery, because surgery was like all the toppers used to take either medicine or surgery. So he took surgery. There's one of his batchmates at that time, he had actually not done well, and he was only the only seat that was available to him was dermatology. During those days, I am talking something around 1970s to 1980s, skin was pretty much a rudimentary branch, and people, radiology and skin, people of lower rank and lower preferences used to take radiology or dermatology. But during his span of 30 years of his teaching, he was still a professor in our college as a surgery professor. This batchmate of his, who actually was sent to dermatology by his destiny, he did not make a choice that he wanted dermatology. That was the only option available to him. 30 years down the line, dermatology actually became a branch which was like very much in demand, and he is currently the very big practitioner of beauty and skin clinic in South Bombay and Bandra. So all special celebrities line up for his appointment, and he's already a celebrity in himself. And my sir was still a professor teaching people about surgery, which most of the people did not listen. So that was one experience. So branch, what is the moral of the story is that the branch that you take, you have to look into future of that branch. You have, by the time you will come out and you'll start practicing and you will be at a peak of your practice, you will be like 10 to 15 years down the line. So you have to visualize your branch 10 to 15 years down the line. Where does that branch stand? And there's a lot of branches, I will tell you that how things have drastically changed in last decade. And certain specialities have become, which people used to consider they are end branch. They are just no more an end branch. You have to do a specialization, you have to do a fellowship, you have to do something or the other to actually get a corporate job in, a metropolis and even in B grade cities. So I will tell you about that. So that was one of the story. There's yet another story I want you to know. There was when I had done my MD and I was doing my DM neurology in my first year. A lot of my students, MBBS students whom I had taught during my medicine period in my MD residency, they actually called me back. So there was this one guy in particular I remember. He was very much enthusiastic about medicine because I was a medicine mentor for them and I used to take their lectures. So they were all very much oriented. They used to inspire me, and they all wanted to take medicine and they were very enthusiastic about medicine. So there was this one guy in particular who called me up and said, "Ki sir, I got a decent rank, but then I'm not getting MD general medicine or MD internal medicine. So I'm getting this MD TB chest, and I'm getting this pediatrics, and I'm getting some other specialities, but I'm not getting MD medicine in a decent college. If I will have to go to a very bonded state or maybe a very interior to get MD general medicine." So I in particular said him that take TB chest, which is a very good branch. And he was very very unenthusiastic about it. He was like, the TB chest is something, some people who keep their life treating tuberculosis. So that was his impression. And somehow I convinced him to take TB chest, because TB chest is just not like treating tuberculosis. It's like an escape route. People study medicine, then they go for DM pulmonology, and then there's TB chest, which is like a direct offshoot, like direct end branch. After doing TB chest, you can still appear for DM cardio examination and DM pulmonary medicine examination, and even DM critical care examination. So he actually was not very convinced, but that time he actually had no other option. He had no other option. He was getting TB chest only from the decent colleges, and for medicine he would have to go into very much interior or any B town city, or maybe he would have to take some bonded state where there is a lot of bond, like 4 years 5 years bond. So ultimately, with all this shuffle, I convinced him to take TB chest. And immediately when I completed my DM, and I had put a status that I have completed my DM, he actually called me. He actually messaged me and said, "Ki sir, this was a very good decision," because suddenly with advent of COVID, there was a very high demand for TB chest that suddenly escalated during that 2 years, and a lot of people have post COVID syndrome. So this is going to be there. It's not gone, and a lot of these patients who are having sequelae again are there. They need the care of a TB chest person. So suddenly that branch, from a very rudimentary branch, from a very neglected branch, that suddenly came into the spotlight, and everything changed. And he was very happy about the decision that he took that time, because suddenly he was yet another celebrity. All papers, there were interviews, there were media people lining up to ask him that how the COVID situation is, what does he think about the COVID situation. So everything changes. Everything changes about the demand, how people the kind of study, the kind of pattern, the kind of practice actually changes within a span of 10 to 15 years. So when you take a branch, always take care about what is the future of that branch. All right, although it may not be very the most favored branch currently, but if you see that there's a lot of future in it, then definitely that branch is a branch that you should take. So I will be talking about each branches separately. each subject separately. So, what is the advantage of that subject? What is the disadvantage of that subject? So, first I will start with radiology, because that has been, since last decade. Suddenly, radiology from a bottom down subject, it has suddenly come to the most preferred subject. Most of the toppers will try to take radiology. Now, the good thing about radiology is that you have, decent life. You don't have hectic timings. You have a fixed hour time duty, and you are basically, you have a ceiling effect. You don't start earning like a cardiologist, or you don't start earning like your people who do intervention. So if you do general radiology, then you have a decent life, and you have fixed time clocked hour duties. But the thing is ki there is a lot of people who do intervention after radiology. So if you do intervention after radiology, you will have a hectic life, but you will have the ceiling effect of radiology won't be there. You can actually earn a lot, but then the life is very hectic. Every time there's an intervention, there's a stroke, or there's some intervention required, they will call you up, and you have to be there within span of half hour or even lesser than that. So if you take radiology and you are very much interested in like making your life a hell, you can go for intervention. But then if money is the only thing that you keep in your mind while taking branch, then you can actually go for intervention radiology after you do your MD neurology, MD radiology, sorry. But the point is, some people don't prefer that life. Most of the people who take radiology have that intention, that they want a peaceful life after seeing how the clinicians, how the difficulties they have to face. They have to be on time, they have to be on your toes every time. They get a lot of time, they are very susceptible to getting abused by the patient. We see that something which is not something alien in a country like India. That's very common. So seeing all those situations, people want to move away from the clinical branch in India. So radiology is an escape route. You can have a decent life, and you actually are not directly seeing the patients. If you go for intervention, again all those headaches will come into play. You have to deal with patients, you have to counsel them for the procedure, you have to manage the complications, and it becomes more or like an intervention branch, like any other intervention branch, like cardiology or stroke intervention, or for that matter gastroenterology. It becomes like an intervention branch. So that is about radiology. One another thing I want you to know about: a lot of people want to take radiology, but the future is slightly dicey about radiology, because with the advent of artificial intelligence, there's a lot of stuff which is done so accurately on the MRs, on the CT scan, which even a radiologist can actually miss. So you see, with the advent of artificial intelligence, which is going to be in the next 10-15 years, it's going to be a part and parcel of your practice. Radiologists will actually have some or the other impact on this, because their demand for making a report will obviously decrease down, and a lot of things will be reported by the computer based analytical systems itself. So a single radiologist can actually tackle a lot of radiology centers, and with the help of artificial intelligence, he can actually manage a lot of radiology centers. So the overall job opportunities may be actually slightly affected in a span of next 10 to 15 years with the advent of artificial intelligence. So that's one thing. Next important thing is, I want to talk about medicine. So we all know that medicine, there's 4 branches I want in particular to mention about. That is medicine, pediatrics, obs gynec, and orthopedics. So a lot of people used to think that orthopedics is an end branch, obs gynec is an end branch, pediatrics is an end branch, but it's not an end branch. Now welcome to reality. Those branches are not end branch. If you are especially trying to practice in a metropolitan cities, obs gynec is not an end branch, orthopedics is not an end branch, pediatrics is definitely not an end branch. So you have to be mentally prepared to again give examination, again try to do a fellowship, or try to do a DM, or any other super specialty degree. Besides this, like obs gynec, most of the centers, most of the people, they will either go for a laparoscopic surgery, or they will go for gynecological surgeries, or they will go for infertility. Similarly, in orthopedics now, divisions have become more or less far more clearer. There are people who go for sports surgery. There's people who specifically do arthroscopy. There's specifically people who do spine surgeries. Then there are people who do ligament surgeries, and it's in a place like so standard metropolitan like Mumbai or Delhi or Calcutta or Chennai. Doing a simple orthopedics will not fetch you a good corporate job. So you will have to do a fellowship. You will have to go for a super specialty, even in orthopedics, even in obs gynec. Pediatrics is anyway now totally accepted that it's not an end branch. Even pediatricians have accepted that it's not an end branch. They obviously aim for neonatology, or they obviously aim for pediatric nephrology, pediatric cardiology, and so on. About medicine and surgery, most of the people know that it's not an end branch. Still, if you like to practice in a B grade city or maybe an interior part of India, you may still be able to do fairly well. But if you want to practice in central cities or metropolitans, then medicine is not an end branch, and people are not paying physicians really well. The corporate jobs are not paid very well for the physicians, and there's a lot of hectic things that you have to do. So that's about these 4 branches that you need to remember. And beside this, there's 2 important branches that I want you to know about: the emergency medicine and TB chest. So they are like 2 escape routes. You want to do a DM straight away, and you don't want to go through all that hecticity of medicine, then you can actually choose these 2 branches, the TB chest and the emergency medicine. But again, TB chest is a good branch, but if you do from a good institute where you learn bronchoscopy, where you learn about other important interventional techniques, then it's like equivalent to DM pulmonary chest. But if you do from a very peripheral institute, then it's more like you end up treating only tuberculosis, so there's no point in it. And another important branch is emergency medicine, which is like slowly coming up. So that itself is equivalent to critical care medicine, which people do after doing their MD medicine. They go for DM critical care. So emergency medicine is one thing, which is again a short route, an escape route for DM if you want to bypass that medicine and general medicine thing. So these 2 branches should be kept in mind, should be kept in your preferences still higher up. If you are not thinking of continuing your studying, a lot of people get frustrated by studying a lot, even at the age of 25, 27. Then they have to study, so they are not very motivated about it, but still they want to end up in a medical branch. Then these 2 fields are very good: the emergency medicine and the TB chest. Pediatrics, as I already told, is definitely not an end branch. You have to be mentally prepared to go for a super specialization. Next, I come on to certain important branches, which people neglect, but then it's totally not worth it, like psychiatry. Now, let me tell you, psychiatry, like just I mentioned about radiology, in future, radiology is going to get affected by artificial intelligence. But psychiatry is a branch which is going to get propelled, or it's going to actually bloom in coming years, because of the kind of lifestyle we live, the kind of addictions we have, everything is this about our psychology has gone totally wrong. So psychiatric disorders are very prevalent, and lifetime prevalence of even simple things like depression and mania are very prevalent. So psychiatry is something which people neglect. They think this is this is kind of a stigmata in India, but it's not true. Psychiatry is a branch of future. You can actually have a very good option if you have a good psychologist. People are manipulating the use of psychiatry to actually enhance people's neurocognitive performance. So there's a lot of demand about this in private sector. There's a lot of demand about this in companies, especially in the human resources and all. So this is a very good branch. There's something known as child psychiatry. People can do a fellowship of child psychiatry, and there's a lot of things about child psychiatry. This is very especially like I practice in Mumbai, so I have seen people after doing psychiatry, they have gone into like de-addiction, or they have gone into a fellowship of child psychiatry, they've gone into a fellowship of neurocognition, and they are doing very well, because those things are very much in demand in metropolitan cities. And even in peripheral cities, psychiatry can do well. You don't need to go for a fellowship or a specialty branch after psychiatry. So psychiatry is definitely a branch that will bloom in coming days. And some people are not very comfortable with psychiatry, because there's a lot of things you have to hear, there's a lot of patience that you need to have. This so totally different mindset. You have to be very inaggressive about things, about how people react. So some people are not very comfortable about that, so that's fine. But then psychiatry, as a branch, is definitely good. You can think about it if you are getting psychiatry. Another important thing I would like you to know about a lot of branches that people neglect, but then they are very good. Like biochemistry is a very good branch. After doing biochemistry, you are even eligible for uh, practicing or going for a DM endocrinology examination. Even in certain centers outside India, biochemistry are eligible for pursuing endocrinology fellowships. So biochemistry is yet another subject that is very good. Obviously, it has been neglected. Another important subject is PSM, preventive and social medicine. People are like, what should I do about preventive and social medicine? That's not true. I will tell you a very nice story about this guy in Mumbai. He is the preventive cardiologist, and he's currently working with a very good institute. It's very reputed institute all over the world. So he actually did his PSM, and he did some fellowship from New Zealand, and he's out there in Mumbai. And every other person is very much worried about his cardiac situation. This obviously, in a family, if you see, every one out of four people have cardiological problems in India. So in a family, so you see, people are very much apprehensive with the young generation, whether I will have a cardiac issue or will not have a cardiac issue. And suddenly this concept of preventive cardiology has come into a super boom in cities, especially like Delhi and Mumbai. So he actually did PSM, and he did a pediatric cardiology fellowship, and he did a preventive cardiology fellowship, and he's out there, he's churning money, and he's enjoying his work, and people are also satisfied because they need something to prevent the cardiac issues that they can have. So similarly, preventive social medicine is again slowly coming up. Besides, after doing PSM, you can actually do MPH, and you can actually go into public health planning. That is another important thing. Besides, public health planning is also important if you are thinking about working in a pharmacological company. Even they require public health people in order to execute their programs. So that's one important thing. Third important thing is pharmacology. So pharmacology is also a very important branch, and in India suddenly there's a lot of pharmacological companies. So I in particular remember one of my MBBS batchmates. He did not do well in his MBBS, and he was like more or less slogging behind, 1 or 2 years behind us. And suddenly he did his IIM. There was a non-engineering quota in IIM, and he did his MBA after his MBBS, and he's currently working with a pharmacological company. He worked there for like 2 or 3 years, and now he's planning to open his own pharmacological company in India. So pharmacology, there are a lot of pharmacological companies in India, and if you want a 9 to 5 job, you are you feel like this, you have been totally stuck up with this medicine, and this clinical things are not actually meant for you, then you can actually go into a corporate after doing MD pharmacology with some issues like MBA or maybe MPH. You can even land up yourself a very decent executive jobs in pharmacological companies. So there's even prospect about that. Beside that, forensic medicine is a very good branch. You can consider it. A lot of people are, personally myself also, forensic medicine, I did not like, doing autopsies or attending those autopsies in my internship. But then, that's part and parcel of forensic medicine. And forensic medicine people are usually powerful people because they are constantly in touch with the police, they're constantly in touch with judges, they are constantly in touch with the lawyers and the legal people. So they are kind of influencers in medicine. Even forensic medicine people, even in government hospitals, they hold a very strong position because they are the people who actually make cover up for all your mistakes that you do. So forensic medicine is yet another good branch, but if you are really not comfortable with dealing with dead bodies, then that definitely that branch is not for you. But if you have some interest about it, and you like power, you like influence, you like to be with all influential people of your town, then forensic medicine can be definitely an option for you. Obviously it doesn't pay you a lot, but then you are mentally satisfied being in that group. So that is one advantage of forensic medicine. Next important branches that I want you to know that people usually neglect is pathology. So pathology is also a very good branch, and after pathology, again you can appear for hematology, you can appear for hemat-oncology. So that branch keeps you open. Second important thing is, after pathology also, a lot of people are, it's not exactly an end branch. People usually do a fellowship of either hematopathology, or they do fellowship of skin pathology, or they do a fellowship of some other pathology. So they are basically, very much in demand. Especially I remember this one ma'am which everybody might be knowing in Mumbai. She is the retired director of Tata Institute of Medical Sciences. So she is actually pathologist, and she is so well versed with identifying cancers in the pathology slide. The slides actually come to her from all over India, even outside India, and she actually does a review opinion about the impression about what the diagnosis has been given on the pathology. She again sees the slides, and she gives her opinion whether this is, this the stage in which it is, the tumor is, or what kind of tumor is it. So she is very much respected, she is very much in demand. Obviously that's a long journey, but then even pathology has some good aspects about it. Obviously even earning is fine, you don't need to deal with patients, but the residency part is specifically very very tough, because you have to go all through all those stool examination, urine examination. But then everything is like that in residency. Whether you take any branch, more or less it's like a mess. So after this 3 years, you should imagine your life, what you are going to do after these 3 years. These 3 years are going to be pretty much a mess, so don't worry a lot about it. So pathology is also one very good subject that you can actually keep. 3 important subjects that you study in your final year or pre-final year, that is ENT, ophthalmology. Now ENT, ophthalmology are branches that are good. You have a clinical touch about it, but the problem, they have a serious problem. They are very much dependent on instruments. So you have, either if you have the capacity of going and doing your own setup, then it may be rewarding. But then if you don't have that economy, or you don't want to go in for that kind of a mindset, then you have to work for a certain other institute. They provide you with all those instruments, and you are there as a worker itself. So then your earning is less, and your life is more hectic. But then you don't have to deal with all those business aspects about getting a machine, recovering all the cost and everything. So that's one aspect of it. But then a lot of people, currently there are a lot of tie-ups, there are a lot of company which do tie-ups, and they make a lot of instruments available to you on lease basis. So you have to work out things, but it's not very fairly easy. It's not a cakewalk in these 2 subjects, the ENT and ophthalmology. But then again, they are good clinical branch. Especially ophthalmology is far better than ENT, because ENT surgeries are very restricted, and people usually do not, you must have experienced that ENT surgeries are not very common, but ophthalmologic surgeries are very common. Cataract is a reality, and it's going to increase in coming future with all those diabetes and everything, vascular risk factors. So ophthalmology is definitely branch which has been a branch of the yesteryears, and it's going to be a good branch even in future. Only problem is all the setup and every input that you need to do. So you have to be at it. So this is 2 other important branches that I already mentioned. The final year subjects, you already know about them. Medicine and surgery are not an end branch. You have to think about doing specialization right away. And even if you are you're thinking of practicing in metropolitan city like Mumbai or Delhi, then you need to think even beyond your super specialization. You need to think about epilepsy fellowship, or you need to think about arrhythmia specialist, or something like that. So even DM is not an end branch for people who are working in a metropolitan city and who seek that corporate hospitals will actually give them some kind of a job. So they need to keep their profile up, and they need to go for even higher studies even after their DM career. So especially these 2, DM neurology and DM cardiology, are very hectic, and there's a lot of neurologists and a lot of cardiologists, so there's a lot of competition. So you need to do some fellowship or something or the other to have an added advantage over the others. So that's one thing. But for all other DM specialties, especially the endocrinology, rheumatology, still there's not much competition, and maybe a span of 10-20 years, even doing a DM endocrinology may be sufficient even for us metropolitan cities in India. So that's how all subjects are there, and I have tried to explain you in the best possible way how you have to, the advantages and disadvantages of each and every subject, and that state counseling will be far rewarding in this current situation this year as compared to all India counseling. So I wish you all the best. I hope that you find lecture important one, as in I have tried to throw some light about all the subjects there, and what are the difficulties that you can actually face while taking a subject, and what are the advantages that you can actually have while taking a subject. So this is all from my side. If you have any queries, if you are still undecided, you can actually mail me. My mail ID will be there in the comment section, and you can keep subscribing to my channel. I will put up videos as and when required, as and when situation is. So all the best from my side, all the wishes. Take a subject very wisely, because you have to live with it for maybe next around 40-50 years, so you can't be very meager minded about it. You cannot only think about money and take a subject. You cannot think only about leisure and take a subject. You have to balance everything. And you have to take a subject as per your choice and as per your rank. So keep that in mind, and I wish you all the best, and heartily congratulations for all your achievements. Thank you.